Hello, I'm Tanni, a PhD student in the Computer Science Department at the University of Central Florida. Today I'll be presenting the findings of our study on the influence of online social media experiences on the mental health of LGBTQ and heterosexual youth. I will discuss the differences in online experiences between these groups, highlight the unique risks faced by LGBTQ individuals, and explore the overall impact on mental health. Social media platforms like Instagram, TikTok, and Snapchat are increasingly popular among teenagers, especially LGBTQ youth. In 2020, about 9.5% of US youth identified as LGBTQ, indicating a growing demographic with unique identity-related needs. A common theme among existing research studies is that they have historically relied heavily on youth self-reports or publicly scraped social media data, which constrains what we know about LGBTQ youth experiences in private spaces on social media. Recent trends show a shift towards private messaging, raising concerns about privacy and targeted harassment, highlighting the need for further research in understanding LGBTQ youth experiences in private social media spaces. This research addresses a gap in existing studies by focusing on LGBTQ youth experiences in private social media spaces. We examine youth's risk-flagged direct messages, DMs, with their self-reported mental health outcomes to examine how the differing online experiences of LGBTQ youth compare with their heterosexual counterparts and how this may influence their overall mental health. We investigated the extent to which LGBTQ and heterosexual youth differ in their online risk experiences on social media platforms and how these experiences affect their overall mental health outcomes. We developed 3 research questions focusing on 3 key aspects. First, examining the frequency and severity of online risk. Second, investigating the differing impact of online risk on the mental health of LGBTQ versus heterosexual youth, and lastly, exploring the unique nature of the online risk experiences by LGBTQ youth in private online chats. In order to answer these research questions, we conducted a user study with 173 youths, including 86 LGBTQ participants between the ages of 13 and 21. First, they completed a web-based survey assessing mental health, well-being, and demographic characteristics, including gender and sexual identity. Then, they uploaded their Instagram data and flagged DM conversations that made them feel uncomfortable or unsafe. Participants categorized individual messages by race type, for example, sexual content, harassment, spam, hate speech, violence, illicit actions, and self-injury, and risk level, for example, low, medium, and high. Aligned with Instagram's reporting features, participants could specify their own risk type. We provided benchmarks, for example, low for discomfort without harm, medium for potential emotional or physical harm, and high for actual harm. In addressing a research question, do LGBTQ youth experience more frequent and severe online risk in their private social media conversations compared to heterosexual youth? Analysis of flagged messages across 3 risk levels showed that LGBTQ youth experience significantly more high severity online risk. There was a notable difference between heterosexual and LGBTQ youth in the frequency of low-level risk conversation, with heterosexual youth reporting more instances. Further examination of flagged messages by different risk types revealed that LGBTQ youth encounter significantly more sexual and self-injury language compared to heterosexual counterparts. In contrast, heterosexual youth reported a significantly higher number of harassment messages than LGBTQ youth. Addressing research question 2, we explored whether LGBTQ youth experiencing negative online interactions in private conversations encounter more mental health challenges compared to heterosexual youth. We found that LGBTQ youth reported higher level of depressive thoughts, self-harm and injury behavior, along with significantly lower scores in mental well-being compared to heterosexual youth. Furthermore, in analyzing the connections between online risk and mental health outcomes, we observed that young individuals, irrespective of sexual identity, demonstrated increased self-harming behavior and more frequent depressive thoughts alongside lower mental well-being scores when exposed to higher volumes of sexual messages via private channels. Next, we studied the moderating effect of online risk and sexual identity on mental health. Our findings indicated that harassment is associated with an increase in self-harm for young people who identify as LGBTQ+, whereas heterosexual youth are less affected. Similarly, we identified a significant relationship between messages containing sexual content directed toward LGBTQ+ youth and mental well-being scores. Sexual messages are associated with a decrease in mental well-being scores for heterosexual young people, while for LGBTQ+ youth, the association is in opposite direction. We qualitatively examined risk-flagged Instagram conversations donated by LGBTQ+ youth to unpack significant effects found in the first two research questions. One of the most prominent themes we found is that most flagged conversation had sexual undertone. For instance, more than 1/3 of the conversation contained sexual content. And almost a quarter of the conversations consisted of sexual solicitations, where most of these received from strangers. There were also some conversations where participants were harassed primarily by their peers because of their sexual identities. LGBTQ+ youth often received advertisements that promoted sexual products and services that were targeted to their sexual identities. Additionally, 1/3 of the conversations included non-sexual harassment such as name-calling and threats received from both strangers and peers. Besides the harassing messages, participants also received different advertisements and scam messages that were not specifically targeted to their sexual identity. LGBTQ+ youth flagged these unsolicited messages as unsafe because they often promoted different products or websites and are intended to cause financial harm. Despite focusing on LGBTQ+ youth's flagged messages, we found they often shared negative experiences related to their sexual identities with peers, including encounters with family members displaying homophobia. Besides this, participants also shared their depressive thoughts, for example, self-harm, suicide, with their peers. In all these messages, we saw their peers being compassionate and providing advice to cope. Participants also occasionally exchanged advice on their drug usage. A few conversations contained messages where one person used illegal tobacco or drugs and the other person gave advice or showed concern for their risky behavior. Let's have a quick discussion of the findings and their implications. Contrary to expectations, we found that increased instances of sexual messages online lead to decreased mental well-being among heterosexual youth, yet they are linked to enhanced mental well-being for LGBTQ+ youth. Our qualitative investigation unveils that although LGBTQ+ individuals face sexual messages that aim at their identities, they also receive supportive messages that encourage exploration without criticism, highlighting the double-edged nature of social media. Our study underscores the significance of differentiating between online sexual harassment and violence and the promotion of healthy sexual exploration during adolescent growth. It also emphasizes the need to provide LGBTQ+ youth a safe space for exploring their sexual and gender identities. Our study reveals that LGBTQ+ youth face significantly more high-risk situations marked by increased instances of sexual messages and self-injury. Conversely, heterosexual youth predominantly report low-risk conversation primarily involving online harassment. This contradicts previous research positioning LGBTQ+ youth as highly vulnerable to cyberbullying. Our qualitative findings clarify this by highlighting that many instances of online harassment experienced by LGBTQ+ youth participants were sexually motivated, categorizing them as sexual rather than general harassment. These significant findings underscore the need for targeted risk prevention programs addressing sexually motivated online harassment and supporting LGBTQ+ youth mental health online and offline. Our qualitative findings provided crucial insights into unexpected and conflicting results from statistical analysis regarding private online interactions affecting LGBTQ+ youth. Our finding revealed that sexual undertones were prevalent in risk flag messages, even in harassing ones, highlighting the close connection between online risk and the sexual identities of LGBTQ+ youth. This underscores the need for online spaces where LGBTQ+ youth can interact without their sexual identities being the central point, a privilege often enjoyed by heterosexual youth. We provide several actionable recommendations toward education and design in promoting the online safety and digital well-being of LGBTQ+ youth. Our study advocates for stronger community-based guidelines, specifically focusing on safeguarding sexual minority social media users, specifically LGBTQ+ youth. Our research emphasizes the necessity of creating safer and more supportive digital spaces for all youth, with particular attention to the unique needs and challenges faced by LGBTQ+ individuals, as providing help, resources, and establishing peer support networks for LGBTQ+ youth who are victims of cyber abuse is crucial. Our research underscores the need for safe online spaces explicitly designed for LGBTQ+ youth. We also highlight the need of developing automated risk detection, differentiating between sexual harassment and exploration. Finally, we underscore the need to foster greater acceptance and understanding of the LGBTQ+ community. Thank you for watching this video. Please refer to the full conference paper for further details on the study findings, including a more comprehensive discussion on the implication of the findings and direction for future research. Thank you.